And as many people have probably already heard, making lifestyle changes is a significant part of the cognitive behavioral strategies for managing chronic pain over time. And so movement tends to be one of the most effective tools for managing chronic pain. And part of that plays into what we discussed earlier about avoidance behaviors. When our bodies are in pain, the tendency is to kind of stop moving and to restrict our activity level, which it seems like it's helpful in the short term, but long term, then those muscles don't have the ability to move, and this can lead to issues regarding circulation or joint health, or just even kind of that feeling of being confident in your body. So regular exercise does tend to help get us back into a pattern of movement, but that does have to be gradual. And so that has to be something that can be done in a more sustainable way over time. And so nutrition, weight management can also help reduce strain and inflammation. As I mentioned before, other patterns of avoidance might include things like drinking. Sometimes drinking also produces inflammation, drinking alcohol throughout the week. And some people might even become reliant on that to help manage the effects of chronic pain on sleep. And so it does become something where, while it feels like you might be sleeping more because you're drinking, it might not actually be able um, to help reduce the pain itself because the inflammation still remains there. And stress reduction practices are essential to this and being able to manage chronic pain over a longer period of time. And these small practices can lead to meaningful changes in how the body processes these pain signals. And so part of it becomes a strategy whereby doing these things, small changes over time, has a more cumulative effect rather than saying something like we're going to try to completely minimize or get rid of the pain overall. So I think that's an important thing when we're talking about strategies like cognitive behavioral therapy. Um, CBT has a lot of research that shows just it can help you feel less overwhelmed by the pain. You can function better in your day-to-day life. You can try to reduce some of the fear and the avoidance behaviors, and oftentimes recover more quickly from pain flares. And so a lot of the strategies around cognitive behavioral therapy is really making some of these lifestyle changes and trying to do it in a way that makes it so that you're um, able to make those changes slowly over time. So it's a bit more calculated and it's something that you have a sense of control and input in as well. Right. All right. So we talked a little bit about mind body integrated practices like yoga and mindfulness to effectuate change in um, managing pain overall. I think it's also important to keep in mind what the research says about what's realistic to expect in terms of these changes. So the research shows that CBT helps people stay engaged in life despite the pain and feel more in control and respond more calmly and effectively to pain signals. So again, being realistic, the goal may not be to completely get rid of pain sensation. And I think if anybody's trying to convince you of that, I think you might be in the wrong place. It's just not realistic when you know you've been living with a condition like this for so long. And so rather than trying to get you to believe somehow that the pain will completely go away, the goal is shifted to how do we become more functional with a more realistic understanding of where the pain intensity and severity is and how we can function within those conditions. One example I like to use is if you have pain that's typically around a 5 or 6 or even 7, on your daily life and the experience of even if that comes down by 2 points in terms of your perception of that pain. And that could be from a combination of different strategies. You know from your own experience that this is something that um, can have a significant impact on the things that you believe you're able to do throughout the day. And so, synergistically putting things together like mind body integrative practices of yoga and mindfulness and using cognitive behavioral strategies, putting those together can be quite effective. And especially when it comes to reducing catastrophizing. So, as I mentioned before, kind of the common beliefs surrounding pain catastrophizing is sort of the belief that the pain means my body might be permanently damaged if I move. There's a fear that you might make things worse, or if you experience a flare in symptoms that might prove that nothing works to you in your mind. Um, and the general worry and concern and stress that goes with thinking you won't be able to do different activities in your life. I did work with quite a few chronic pain patients during my time conducting my dissertation around this 8-week study that we have. And for patients that were involved in that protocol, we did see significant changes in pain catastrophizing. So when you're a bit less distracted by some of those thoughts surrounding your pain, it does create a little more room for other aspects of your life to become maybe more meaningful, or that you can participate and engage a little bit more with. So um, I wanted to just add here, as we're talking about it, some different articles, and I'll share these articles probably in a follow-up sheet with you, from Williams et al. That goes over psychological therapies for chronic pain. There's another one from the Cochrane Review in 2023 that shows that even remote interventions using CBT for chronic pain can be effective, especially when it comes to musculoskeletal pain. There's some research, very good research around targeting that type of specific pain. And also CBT combined with physical therapy. These strategies, when put together, can tend to have a synergistic effect, so leading to a slightly better improvement than just doing something like cognitive behavioral therapy alone. While there might be some efficacy or mild to moderate improvements, you can have much more significant improvements by adding some of these different strategies together. Uh, so we'll go to the last slide here. So I just wanted to give a little bit of background information about a group that we're going to be offering here through the Halliday Center. Um, for those of you that might be interested in some additional support, this is an 8-week chronic pain group that we're going to be doing virtually, and includes a brief screening process and clinical interview to ensure that it would be a good fit. But we'll meet weekly virtually for a 1.5 hour of guided yoga mindfulness practice, and we'll be going through some of the very specific pain coping skills and strategies for how to manage chronic pain. And the goal is to help you feel more confident in moving your body. And as we talked about throughout this program, just really rewiring this relationship with the nervous system so that it's something that you can learn to trust again, and you can find a sense of safety and security through movement. Because I know working with chronic pain is something where it becomes a process of really not trusting your body in different circumstances. And I have a lot of compassion for people who are going through that. And with that, I'd like to open it up for some questions that you might have.